My name is Beth Flitcroft and I've worked with Tezlom since June last year, so about 15 months. I started working all over the place and I've ended up being in a certain few places that I really enjoy working. I actually started with Tezlom because I'm a student nurse, but my partner's a scaffolder and he's hurt his back, he's pulled a couple of discs in his back. So I had to take a year out of my studies and I typed in agency recruitment on Google like you do. I saw Tezlom and its name was very unusual and I thought I'm going to have a look at that because you normally see bog standard agency names and they're all the same. So I seen Tezlom and I thought I'm going to have a go. I applied for it and I got an immediate response back. It was in the matter of a couple of days and I was like really excited because it was an agency. I'd never worked for an agency before. So it was during COVID times, like difficult times as well, so we did it all over the internet and I got the job. So my plan is I took a year out of my nursing degree and I plan to go back to that in January to complete my last year, and hopefully when I've got my qualifications I'm just going to stay with Tezlom, but I'm going to be a nurse instead of a support worker. I've always worked in health and social care. I was a domiciliary carer a couple of years ago and I enjoyed that because I get to go to different places. It wasn't just the same job day in, day out, getting used to the same routine, because I found that very, as much as I loved my job and because I worked in a nursing home, it was too repetitive. And as much as I loved caring for these service users and the people that we support, it was just, there was nothing to progress from that. So I tried domiciliary care, which I thought was better because obviously we travelled around, it wasn't just one place. And obviously I've got a history of nursing and care work, and that's why I decided to apply for an agency while I was out of uni.